Baby Shark. That's a classic. Okay. All right, welcome guys. It's 5:30. Let's get started. Y'all know how I am about time. Welcome to the Full Circle Women's Care Pregnancy Orientation. I am your host, Dr. Adams. And let's see, some of you had your history visits today, and some of you are going to have your histories coming up either later this week, Friday, or I'll see you next week. So thank you for joining me today. Um, Back at you. So let's get started. Let me know if you're able to see my screen that has the presentation you decide we deliver. Cool. Let's move on. First, some housekeeping things. First, this is confidential, so I can see who's on the call. I'll get a report of who's on the call, but other people won't be able to see. Um, if you have questions to ask. So please feel free to use the chat feature to ask me questions in real time. I have some poll questions that are hidden throughout here to make sure that we're all kind of paying attention and all of that. And then if you have to hop off at any point, the rest of the presentation will be available for you to watch on our YouTube channel. And I have a question already. If complications occur during pregnancy or delivery, hold on just a second. We're probably going to get to some of this. So give me just a moment and we will start with the questions in a bit. Hold this one, and if you don't think that I answer it during the webinar, you can ask this one at the end, okay? All right. I love it. Y'all are straight out the gate asking me questions. Next. All right, let's start with a poll question. So our first question is, who's on the call? So how many first-time moms do I have, and how many veteran moms do I have? And the questions will go like this. I'll read them out. I'll give you a couple of seconds to answer. I'll say the polls are closing. I'll hit the end poll button, and then I will share the results. So today, the first-time moms are slightly edging out the mommy veterans here, which is helpful for me because it lets me know when I need to spend more time on a certain subject. So today, the things we're going to go over will be the full circle experience, which will speak to that question that we just had. We'll talk about where we deliver, which will include some of our office protocols, how to best reach us, go through what to expect at your pregnancy visits. We're going to give you lots of prenatal resources. So remember, again, this is available on our YouTube channel. You'll be able to go through and find what you need. We're going to talk about exercise and nutrition in pregnancy, and then wrap up with an upper respiratory illness update in general. So first, we'll start with the philosophy of the practice. The collaborative midwifery model operates under the auspice that pregnancy and birth are normal life processes. This is not a disease that you've contracted that we have to cure you of. It's a physiologic process, and midwives typically care for the physiologic process of labor. In the traditional midwifery model, it's just a midwife by herself, and she can care for normal, low-risk women with no complications. And if there are certain abnormalities, she would have to transfer out of midwife care in order to access physician care. In the collaborative model, you still have the care of the midwife with the physician direction for any issues that you may encounter. So if you're expecting to deliver vaginally, you're probably mostly going to see the nurse practitioner midwives here. And as some of you all started as our GYN patients, my patient, Dr. Marrow, Dr. Mooney, and then you're like, okay, well, I'll just move over to the OB side and the doctors will continue. But on this side, on the obstetric side, the midwives are typically managing the physiologic part of labor. If you do develop an issue, they consult with us. We make plans. So if you hear a plan for some issue with your pregnancy, it didn't originate with the midwife, it came from the physician. But the labor part, that's the physiologic part. So labors and deliveries are attended by our certified nurse midwives. That's the part where, your cervix opens, your baby descends and comes out. That's what midwives do. If your baby is not participating in the usual way of that, there's something beyond the midwife scope, then they call the physician consult for during labor. If it's something urgent, like needs to be addressed, like can't be scheduled, they consult either myself, Dr. Marrow, Dr. Mooney. We're always on backup for our midwives. If it is something emergent, like cannot wait 20 minutes for us to get to the hospital, there are board certified OBGYNs who are in-house 24 hours a day for true emergencies. And in 2024, we did about 600 deliveries. We used the hospitalist service 4 times. And most commonly, it wasn't because there was something bad, but because there was something fast. If you get to the hospital and you're 10 centimeters before either our midwife or one of the physicians can get there, then the hospitalists also know how to catch a fast baby. So which hospital do we use? We are at HCA Hospital, which is less than 10 minutes from our office. We've been there since the fall of 2023, and it's been a good move for us because we have a very supportive administrative staff with regard to our approach to holistic patient-centered birth. We encourage you to take a tour of the facility. They have quarterly stork tours. We'll be announcing those dates shortly, but every 3 months, they have a tour where it's like a big baby shower. They raffle off prizes and there's food, and the doulas come out and have vendor tables. But if you're not able to make it to any of those 4 dates, they have tours in between with our childbirth educator. So you just go to their website, hit the register for a class button, and select labor and delivery tour. And she does those twice a month. Just pick a date and register for it. In the office, our office is open Monday through Thursday from 9 a.m. to 1 p.m. We then close for lunch from 1 to 2, and then open back up at 2 and are open until 5. So when we close between 1 and 2, the office phones roll over to the after hours line. The reason we do that is because the after hours line is connected to the on-call provider. So if you're having a medical emergency between 1 and 2, you're still able to reach the person who is in the hospital. So please don't leave administrative messages on the phone during lunch, like saying, oh, I'm going to be late for my 2 o'clock appointment. She's not going to relay that to the front desk because she's the emergency on-call person. She's in the hospital taking care of people. Just hold that until 2 o'clock. Give us a call back. We are open on Fridays from 9 to 1. So if you're calling with something administrative at 12:50 and for some reason may have to leave a message, we may have to return that call on Monday when we reopen. If you call back again after hours and get the emergency on-call person, again, she doesn't do the administrative stuff. So to reach, you just call the same number for the emergency on-call that you would normally call during the regular business hours, but when it's time for the after-hours person to be on, it rings to her phone. With regard to appointments, we don't have walk-in appointments because our goal is to see you at as close to your appointment time as possible. And in order to do that, we have to plan what time that is we're going to see you. So if we say we're going to see you at 10:30, even if somebody walks in at 10:35 and says, hey, I have a problem, I need to be seen right now, that's not fair to you because we promised you the 10:40 spot. So, you'll have the same respect for your fellow patients. We do have a limited number of same-day appointments. People deliver, cancel, reschedule appointments. So if you're calling in the morning and asking, hey, I think I need to be seen today for this thing, and there are openings, we're happy to add you into a scheduled slot in the day. Now, if you're calling at 9 a.m. and you have an urgent matter like, I'm not feeling my baby move or I'm bleeding a lot, we're not going to say, oh, yeah, there's a spot at 3 o'clock and have you waiting 6 hours to see one of us. If it's an urgent matter, we might recommend, hey, I think you need to go to labor and delivery to be seen to get that checked out. Or if you're having chest pain, difficulty breathing, we're going to say you may need to go to an urgent care or the ER. It's not us saying that we don't want to see you here in the office. It's us saying, yes, we agree this is something urgent, but we don't have an opening for you. And we want you to be seen and taken care of. And we'll get the report and follow up. When you're calling, the providers are not able to leave a patient appointment to take phone calls because, again, we're seeing patients. And when you have your appointment at 2:20, somebody calls at 2:25 and says, hey, I want to talk to Dr. Adams. Well, it's not fair for me to give them your appointment time. You drove across town and came in to see me, and I get up and walk out and talk to someone else. It's rude. But we do have someone who is taking messages, especially for clinical items. But if you're calling and she's on the phone with someone else, just definitely leave a message, because if you just call and hang up and call and hang up, then no one's going to know that you actually called. When you leave messages, though, be sure you are leaving them in the right space. Please do not leave messages for our billing team about your mucus plug, because one, it freaks him out, and two, he does not know how to help you with that. So if you have an issue with pregnancy administrative stuff, for the time being, Sierra is taking our nurse phone calls. She'll also be the one to help with FMLA and short-term disability. Again, I said for the time being, that's going to be changing pretty soon, because she is moving. We're going to miss her. Our OB clinical coordinator is Naisha, and some of you have already had some interaction with her because she will help us coordinate labs, referrals to high-risk doctors. At the end of pregnancy, she's the one who helps you schedule if you need an induction, if you need a C-section, aversion, if your baby needs a circumcision. She's your girl for all that kind of stuff. And then many of you have already met with Renee Hall, our benefits coordinator. If there's anything related to insurance, Renee is your point of contact. So she's the one who talked through your prepayment plan. If anything changes with your insurance, you're like, oh, husband broke his leg and we met our deductible, please let us know, because we don't want to keep collecting on something that we really don't need to. Again, after hours, there is always someone from our practice on call for our practice. That's the emergency on-call provider. And this is the person you call if you think you need to join her in the hospital. And remember, you have to leave a voicemail message to receive a call back. So to reach this, you just call the regular office number, and if we're not in regular business hours, it will automatically roll to the after hours line. Just follow those prompts and you will reach one of us who will take care of you. Another way to reach us is the patient portal, but remember that response times can take up to 2 business days. And if it's a non-action item, like, I was just wondering whether vitamins are important, that's something to discuss at your prenatal visit. And so that's something that we may forward to the next person who's going to be seeing you here in the office. The portal is best used if you need, like, you have an action item. I lost my lab slip and I need to get labs done before I see you guys again, or I have an upper respiratory infection. Can I convert my appointment to a virtual? That's what the portal is really meant for. It's not meant for urgent matters. So if your blood pressure is high, you don't feel your baby, you're bleeding heavily, don't send a message, because like if you send me that message on a Thursday, the next 2 business days, like I might not see it until Monday. So that is a phone call. So call the regular number, even if it's after hours, and it will roll to the after hours person. We also ask that you don't send blitz messages, which is copying and pasting the same message to 10 different people. We had someone very upset once. She went to the pharmacy and she had 5 different prescriptions for the same thing, because you can treat things with 5 different things. But she didn't know you sent messages to 5 people. So one, multiple messages to one provider and or to different providers, aside from being abuse of the portal, isn't an efficient use of our time or of yours, and it can create confusion. If you're talking about one thing with one person, please reopen that same message and continue the same thread with that person. Can't tell you how many times I've opened a portal message and the message is just, so now what? I don't know what we're talking about. And so we waste time, 4 business days going back and forth with us trying to figure out that you actually started a conversation with somebody else and there's another step that you're trying to get. And so in that respect, we ask that you don't try to have an appointment over the portal. So if you're, uploading labs and ultrasounds and asking us about, research and different options and pros and cons, that's an appointment. So we ask you to text yourself those kinds of questions so that we're not going back and forth, or schedule an appointment, because the portal, like I said, it's for action items. We've seen patients for 8 hours during the day. Then we've done our ultrasound review, our lab review, and now we want to spend time with our families. If there's something quick that we can do to make your life a little easier, yes, absolutely, but not have like 10 more appointments afterward on the portal. We do use the portal to release your ultrasound results, unless there's something urgently abnormal, in which case we will not let you leave the building without discussing what's on that report and making a plan for it. Otherwise, we don't get the ultrasound reports right away. It's just like if we sent you to an outside facility. The tech completes her report. It gets uploaded to, we download it from her machine, upload it to our electronic medical record system, and then assign it to providers providers to review. So it's about 2 business days before we actually get it. Now, if you know that your anxiety will not let you wait 2 business days to see it, make an appointment, like make your regular OB appointment on the same day to follow your ultrasound, because the techs can print out a preliminary report to address whatever, urgent issue you were looking to answer. And then you'll get the full report within 2 business days. So sometimes you'll see Taylor or, Kathleen typing away, and you'll go out to your car and say, "What's on my report?" You put that on the portal. I don't know. So give us a chance to receive the report, review it, respond, and release it to the portal with our commentary. Quest, which we don't use quite as often because we do draw labs in the office now. Yay. Quest also has a portal. Sometimes they'll send the results to you before they send them to us, and that freaks you out because you see all this red all over the report. But just deep breath. Remember, red does not necessarily mean abnormal. Pregnancy reference ranges are different. So the reference range that they use to tell you what is normal is what is for people who are not pregnant. And there are some physiologic changes of pregnancy that allow certain abnormalities or some things that would look abnormal in someone who's not pregnant. So give us a chance to receive the labs from Quest. Please don't log into your Quest portal and upload the results to us, because that doesn't close our electronic medical record loop, which is very important to us. But give us a chance to receive it. Now, if you've been sitting on the results for over a week and you haven't heard anything from us, sometimes Quest doesn't send it to us, or we don't get it. And so let us know so we can request it from Quest and then get that to close our loops. The most common reason we don't get or receive reports is if you're using different names, though, at different facilities. This happens with high-risk doctors, consultants, wherever, even the hospital. We ask that you please use the same name at all facilities. And ideally, that name should be the one that your insurance company thinks you are as well. Some of you are changing your names during pregnancy because you never got around to it, maybe after marriage. You're a Smith on paper, but a Jones in your heart. So whatever you are at the insurance company, please be that. Alternative name use guarantees delays. We don't have a fax machine here. All documents go to an electronic fax in Massachusetts. And if it does not have a match to your first and last name and date of birth, it will not sort electronically into your chart. And it makes it a lot more difficult for us to get you that information quickly. All right, any questions about contacting us, appointments, any of that sort of thing? All right, cool. Next, what to expect at your prenatal visits. 1, expect that when you hear that little heartbeat, it automatically makes you forget everything else you wanted to talk about today. So start a text thread with yourself with the questions that you want to ask at your next visit. Sometimes you'll send things in the portal to us and we'll say, hey, bring this question to your next visit. Go ahead and copy paste that into your text thread to yourself so you don't forget it, because we do want to answer your questions. We want you to wear loose, comfortable clothing so that we can access your belly. At every visit, we will be listening to your baby's heartbeat, not doing an ultrasound at every visit, but listening to baby's heartbeat. That's how we ensure that baby is still doing okay. We'd like you to get here about 5 minutes before your scheduled appointment. That'll give you time to check in and handle any business at the front desk. And if you need to leave a urine sample, give you some time to do that before you're being called back. Not everyone needs to leave a urine sample routinely. We used to do that on everybody, and the American College of Obstetricians says it's low yield. You'll know if you need to leave one. If we're following someone with high blood pressures looking for urine protein, or high blood sugars looking for glucose in your urine, or if you had a recent urinary tract infection or symptoms, and we need to check to make sure that your cure is worked, or that you don't have a UTI still. If you're 10 minutes late, it does still give us a chance to check on you and your baby, but it leaves less time for our little text thread of questions. If you're 20 minutes late, you have missed the entire appointment slot. But we may have time to work you in later in the day. Like I said, there are sometimes open slots later on. Front desk is really good about, oh man, traffic is bad. She's going to miss this appointment. The next one is already here. but I see that this other midwife has another open space. Let me see if she's able to get over there. If that time doesn't work for you, then we can just reschedule you, or, to another day that's better for everybody. Another question about appointments is when am I going to get another ultrasound? That was so much fun. So diagnostic ultrasound appointments are separate from your prenatal visits. The way to know whether you have an ultrasound scheduled is to look in your portal and see, do you have more than one appointment time, and is there a provider's name associated with your visit? So this is Tina Test, my imaginary patient. Tina logs into her portal and she clicks on appointments, and she sees that on the same day, she has two appointments. Her first one is at 9:20 with ultrasound, which is not a provider's name. Her second one is at 10 a.m. with Dr. Yeckel, which is a provider's name. So Tina knows she is going to have an ultrasound, and then afterwards she'll have a visit with Dr. Yeckel so she can get a preliminary read on what the ultrasound showed for that day. If she doesn't have that, if she didn't have that second appointment, then her results would be sent to her portal within 2 business days, unless there's something urgently abnormal. This is the time that we will break our schedule. Someone will come and talk to you, and we'll make a plan for anything abnormal that we see on the lab, get you referred to a specialist, talk to Naisha, and get that all set up for you. So if you're checking out of your appointment and your midwife said, hey, your anatomy ultrasound is coming up next, when you get to the front, make sure that front desk is scheduling more than one appointment. So they should be scheduling your anatomy ultrasound as well as your next prenatal visit, even if that's not on the same day. We don't want to miss you getting your appointments scheduled. If you would like to look at your baby more than medically we need to for diagnosis, there are wonderful places in the city that do boutique ultrasounds, and these are fun ultrasounds. So I listed a couple on here for informational purposes, not necessarily endorsing anyone, but these are in different areas of the city. They do all sorts of cute stuff, like put the baby's heartbeat in a stuffed animal, and they do 3D ultrasounds and all of that. We don't do 3D here, but we do other things for diagnosis. So just know that these are out there. All right, we have another poll question. All right, so when should you expect to get routine ultrasounds? Are you going to get them at every visit, at 20, 40, and 41 weeks? Or do you only get ultrasounds if you have a problem? And the polls are closing in 5, 4, 3, 2, 1, done. All right, awesome. Yes, oh my gosh, I think this may be the second time ever that everybody got this right. At 20 weeks is your routine anatomy ultrasound. So if we see everything we need to see then we don't need to repeat it unless you go past your due date, which is 40 weeks. And then we do post-dates testing for everyone after 41 weeks. Fantastic. This is a rock star crowd. I knew it would be. All right, we are going to move on. Let me know if you can see the Full Circle website now. Give me a thumbs up if that's what's showing, because if not, I can. Okay, cool. All right. FullCircleJacks.com. So the next portion of our program, we'll go over information that is accessible to you forever and ever. Hang on, I have a question out here. Actually, just a hand raised. Oh, okay, just a hand saying that you're able to see it. Got it. Thank you. All right, so let's start with the providers. So one of these lucky ladies is going to have the opportunity to help you welcome your new little one or ones to the family. This is me with more hair. This is Dr. Marrow, this is Dr. Yeckel, Dr. Mooney, and then we have the midwives in order of how long they've been here. That's midwife Lauren, midwife Krista, midwife Cindy, we'll come back to her, midwife Norma, midwife Kayla, midwife Jordan, midwife Brianna, and midwife Jackie. Coming back up here, this is Vanessa. Vanessa is our PA, and she attends our belly births. So if you know you're having a scheduled cesarean for whatever reason, Vanessa, you'll have most of your visits with her. She'll make sure that you meet with the physicians as well, because we know that one of the 4 or 5 of us will be attending your delivery. So feel free to, browse this and click on more information to learn a little bit more about each of us, because we're going to know a lot about you. All right, over here under patient information, you'll see the obstetrics tab, and you'll know you're in the right place because you'll see the bellies over here. First up is our delivery stats. I'm going to click on this and put my host on the spot. Okay, so we'll be putting our 2025 numbers up very soon because we do have them. And spoiler alert, our 2025 was better than our 2024. So many of you are here because of these numbers. Like, what is our labor to cesarean rate? What's your chance of having a successful vaginal birth after cesarean? We're very transparent with our numbers and very intentional about our goals. So if we're recommending something for you, trust me, it is not because we're trying to get out of there and do things the easy way. It's because we are trying to maintain safety and help you safely get the delivery that you're looking to get. Next up is our prenatal care timeline. So this is what to expect at each visit individually. So everyone on here has already had their confirmation visit, which we like to do between 8 and 10 weeks. At that visit, you see Taylor. She does an ultrasound to set your due date, and you meet with the midwife and you talk about any, urgent issues that you may have. You guys will have a quick conversation with Renee about your insurance and all of that. And then they'll tell you you're going to have a virtual visit with Dr. Adams. So the virtual visit is not here on Zoom, but it's on another platform, Doxy, which is our secure medical platform. And then when you talk to me, if you have not already completed your standard blood work, I make sure that the order is in for that. Sometimes you're closer to 10 weeks and you go ahead and complete your blood work at your confirmation visit. But really, we just like to have that done before the end of your first trimester. If you opt into doing genetic testing, you have to be a minimum of 10 weeks to do that. So again, that kind of plays into when you get that done. At this point in pregnancy, though, we are seeing you in the office every 4 weeks. So roughly 4 weeks after you had your confirmation visit, we bring you back for your OB physical. And the physical is just like it sounds. It is heart, lungs, breast exam, pelvic. Doesn't necessarily include a pap test. I'm stressing this. So the pap test is the screen for cervical cancer, which is not part of the standard ACOG panel for testing because pap tests only need to be done every 3 years. If you're due for a pap test and you'd like to have it done during pregnancy, you're welcome to, but it's not required that you have a pap test as part of your OB physical. Part of the ACOG standard panel, though, is cervical cultures, and these can be done as a self swab. Like you can swab yourself, and it does not need to include a speculum exam. Those of you who need to see the high-risk doctors, that's typically something that we determine when you have your medical history visit with me, your virtual visit with me. And usually the high-risk doctors see you right around the 12 to 14 week mark. Then we move into second trimester. If you plan to do additional genetic testing or testing for spinal cord abnormalities on the baby, that's done between 15 and 20 weeks. And then your anatomy ultrasound right around 20 weeks. So you'll see here in the middle too, the mental health screen. So a lot of press goes to postpartum depression, postpartum anxiety, postpartum rage. There are warning signs for a lot of those things early in the pregnancy. And as a holistic practice, we actually start screening you very early for this. So it may not happen at this visit particularly. Some of you may get this as early as your OB physical exam. We're not singling anybody out. We're just making sure that we get everybody before the pregnancy is half over. Because the earlier we can identify people who are at risk for those issues, the better you'll be when it's, time to cope with any of it. After the anatomy ultrasound is when your midwives are going to start talking about childbirth education classes or breastfeeding classes. And I'll talk more about that in just a moment. About 4 weeks later is when we start looking at the glucose test. And I know I'll have questions about glucose, so we're going to put a pin in that and I'll get back to it. My moms who found out that they had a certain blood type early in the pregnancy, we talk about whether or not you also need to get RhoGAM to protect future pregnancies, and we'll talk about that on an individual basis. But this is around the time when we have you register at the hospital. For those of you who are with us when we were at Ascension and it was paperwork that you mailed off, now everything is online. Yay. You scan a QR code, create your hospital account, and get your verifications electronically. Want to make sure that you're getting your hospital tour in, and if you have not, this is actually more of a final date buy. You want to select who your doula is going to be. The doulas have actually asked me to have y'all start doing this earlier in your pregnancy, so start thinking about who you may want to work with as a doula, and we'll talk about doulas in a moment, a little earlier than your third trimester. So when we start, after we get past that 28-week visit, we start seeing you every 2 weeks. You will have an option to repeat or decline your standard OB panel. One is an ACOG recommendation, the other one is Duval County Health Department. If you feel you're not in a high-risk population and don't need to repeat these tests, you can feel free to opt out of them. For those who intend to repeat vaccinations to have autoimmune antibodies, or excuse me, antibodies, passive antibodies to pass to baby during breastfeeding, early third trimester is the best time to do these, and your midwife will be discussing doing it. We don't have those here in the office, but if you need prescriptions, we can tell you where to get them and that sort of thing. First time moms, this is when you want to start looking for a pediatrician, because yes, the baby is our responsibility while the baby is physically part of your body. Once the baby separates from your body, he, she, or they need their own doctor. And then, like I said, we start seeing you every 2 weeks. So at the 32-week mark, moms who have a certain pregnancy complications will start additional testing. Those who know that they're having a belly birth, our word for the C-section, we start getting you scheduled for those around the 33-week mark, because the calendars on labor and delivery open about 2 months ahead of time. Typically, belly births are scheduled somewhere between 37 and 39 weeks, and so everyone for belly births is off the train by 39 weeks. Then after this 32, 34, then we see you around 36-ish weeks, and we do a screen for group beta strep, and we'll explain what that is and why it is important. If you've opted out of repeating STI screening in third trimester up here, then you can also opt out of it down here as well. But this is when we start your weekly appointments. So it really ramps up at the end. You start seeing us every week. And at 37 weeks, you are full term. It's not your due date, but you are full term. And so this is when your birth plan starts to come into play. And we'll talk about birth plans in just a moment. You start your natural cervical ripening methods, which I'll go through in a second as well. And then when you hit your due date, which is 40 weeks, you do the hardest part. Be patient, be patient. And then if you're past that, we do our post-dates testing, and we like to have everybody out and delivered by 42 weeks, because that is when our risk of stillbirth rises significantly. So for first-time moms, the average length of labor for you is about 24 hours, and it might take us 24 hours to get you into labor, because it's not a boom, boom, boom process with us. We do what we call gentle inductions. For second-time moms, your second labor is usually about half the length of your first labor. So you get to 41 weeks and 6 days. So remember, this is out here, print it out, highlight, ask questions, all that good stuff. The question here on the board, I have, why is full term different from the due date? Great question. Full term actually has to do more with baby's lung maturity than the actual due date. So these dates are really more for us in terms of what is more likely to happen to a baby when you are 34 weeks, 37 weeks, 40 weeks, 42 weeks, than it is for the terminology of being term versus preterm. So it has more to do with like what is the NICU expecting when they get a baby that's 36 weeks versus 38 weeks. So I wouldn't focus on any of that, because babies don't have calendars. They're going to come whenever they come, but it's more for us in terms of managing pregnancy and managing expectations. Gestational diabetes screen. So I told you I was going to come back to this. This is not that time. I'm going to come back to it later, but I want you to know that this is out here when it's time for you to do your glucose screening. I'm going to refer back to this, because this has lots of information for when it's time to take your glucose test in that early third trimester. Weight gain in pregnancy is a question I get a lot, because it's what we do during pregnancy. We gain weight. So there's a link on here. You can put in your pre-pregnancy height and weight, and that'll give you what your body mass index was. And then based on what that is, this tells you what your recommended weight gain is for pregnancy. If you have twins, you can add 10 pounds onto the upper limit of each one of these. But what I really want you to see is that the rates of weight gain are here for your second and third trimester per week. First trimester, you are sick, you don't have an appetite, nothing tastes good and it doesn't feel good, and you might even lose a couple of pounds and it freaks you out. Don't worry. Babies are adorable little parasites. They are taking the best of what nutrition you already had, which is why we tell people start your prenatal vitamins before pregnancy. And so in second and third trimester, when you feel better and are eating more, that's where we start measuring your rates of weight gain. So don't let it freak you out if you've not gained any weight in your first trimester. Next, we'll look at your birth preferences. So especially for first-time moms and for moms who are going for a vaginal birth after cesarean, it can be overwhelming, going into a new environment and not knowing what and not knowing what you don't know. How do you plan for what you're not expecting? So this kind of helps to ease some of the anxiety about it and help with conversations with the providers. So each one of these little boxes addresses a different thing that, medically speaking, nothing dangerous on here. Like if these are matters of opinion and preference. So go through and see which things are most salient to you. But a couple that I want to highlight. We have been saying, obviously we have tubs for labor. So hydrotherapy is there, but the nitrous is finally in. We have a policy. I'm working on one little last piece of it, but by the time you all deliver, there will be nitrous that's available, like what you breathe at the dentist's office, to help you with the discomforts of labor. But things I want to highlight are that we don't strap you to the bed, starve you, all that stuff, make you, be on your back. You can labor in any position, push and deliver in any position. All those things are fine. Our standard things are usually perineal massage, warm compresses, delayed cord clamping, early skin to skin. If you're doing something different like stem cell, cord blood banking, let us know so we can, just kind of talk through what all of that looks like. Standard medications that are offered to the baby are on here. You have opportunities to come in and talk to the midwives about, what is this? Does this apply to me? Do I need this? Whatever, what you plan to do with your placenta. Some of you are having twins. There are options there. And then there are belly birth options too. If you're having a son, there's, options for circumcision. So just know that all 21 boxes probably don't apply to you. So if you take one box per week, you should have plenty of time to go through everything and create, at least starting the conversation with your midwife as you get closer to your delivery date. Next, the cervical ripening techniques that I referenced before. So these are a bunch of different things from Evidence-Based Birth. I just pulled everything into one document so you don't have to go scouring around, because at the end of pregnancy, all of you are like, how do I get this baby out? So at 20 weeks, you can start your raspberry leaf tea. Obviously, you don't want to do that unless, we don't want to do that if you're having hypoglycemia or you're already having preterm contractions. So just read through the whole thing, because everything is not for everybody, but these are things that are reasonable for almost everyone to try, because they don't put you into labor. They prepare your uterine tone and your cervical softness, so that when your baby gives the signal that it's time for labor, your body is ready to respond to it. Next, I know we had some first-time moms on here. How many moms do I have on here who had a C-section before and are looking for a vaginal delivery? Who's going for a VBAC, vaginal birth after cesarean? Okay. All right. Okay. All right. There are a couple. All right. You're trickling in, and the polls are closing in 3, 2, 1. Done. All right. So, VBAC moms, so vaginal birth after cesarean moms, and first-time moms. Listen up. This is for you. This is for you. So the most common reason that we do cesareans is not because the baby is too big or the baby is in distress. The most common reasons cesareans are done are because of baby's position. So position, position, position. I stress this over everything. Babies are going to baby. Control what you can. These are ways to reduce conversion to cesarean. If you go back and look at my stats, our conversion for laboring moms going to C-section usually hangs somewhere around 9 to 11%. So it's not a lot, but these babies are fighting us every step of the way. So please seek a Webster certified chiropractor. We'll talk about that in a moment. Do your yoga and Pilates. Do your method courses. Do your squats. I'll talk about those soon. Watch the weight gain, because babies also shift into weird positions if they have extra space to do it. Don't cheap out on the doula. Look at spinning babies. You can read all of these things, but this one, please, I want to emphasize, trust your body and trust us. because again, we're not trying to push you into things that are going to push you toward cesarean. I really like my labor conversion rate of 9 to 11%. So I'm not trying to do things to push people into ruining my stats or harming their babies. Um, Other thing, that I'm going to go back to this one because I don't think that I went through the pregnancy safe medications. Let's say you had a headache. Are you more likely to take a Tylenol, meditate, or go to the emergency room? Like, are you one who thinks no medications during pregnancy? I'm not allowed to take anything. All right, polls are closing in 5, 4, 3, 2, 1, done. All right, so today we have more meditators than medicators. I wonder if that's proportionate to who already has kids in the house. All right, so this is a list of common pregnancy discomforts in alphabetical order. In the middle, you'll see the relief measures. So if you send a portal message that says, Dr. Adams, my back is hurting, what can I do? The first thing I'm gonna do is literally recommend the things that are right here. So some of y'all are getting smart and saying, okay, I've already tried everything on the website, Dr. Adams, what else can I do? That is when we actually do want you to reach out to us. But the relief measures for some of these things, try these things first. Like, go for the relief measures first. Look at the warnings for what's available over the counter. There's a couple of pages of it here. But we are in cough, cold, flu, and unnamed crud season. So there's things on here for congestion and cough and sore throat and dizziness and all of that. So please be sure to consult this before, just sending a message saying, what can I take for? Because it's here on the website. And then if those things aren't working, then definitely reach out because it may be time for us to either evaluate you or send in a prescription. And then lastly, we have circumcision care. So circumcisions are not done in the hospital. They're done here in the office before little one is 10 days old. If you decide you want to do that, usually we'll ask you during pregnancy and confirm it after you deliver. But then excuse me, and we'll send a message to Naisha and she'll get his little appointment scheduled. And then this is information on how to take care of it after the circumcision. So myself, Dr. Mara, and Dr. Mooney, one of us will take care of your little guy. So remember, all these things are out here at fullcirclejax.com under patient information on the obstetrics tab. Question I have out here: are airborne, Zicam, elderberry, basic vitamins okay to take while getting sick? Yes, 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 and yes. I don't think any of those have high doses of vitamin A, but most of your vitamin combinations are going to be okay. Just want to make sure you're not getting in more than 100% of the recommended daily allowance, specifically of vitamin A. Great question. All right, we are headed back to the presentation, and let me know if you are able to see this delicious Starbucks drink this morning. You guys are expecting babies, and today I dropped my nearly teenager off at Starbucks, and oh, that made me sad. The question here: how much melatonin can you take? So the recommendations are a bit lower for pregnancy. You want to start with the lowest amount possible. So really, you're looking at like kitty doses. So start with 0.5. If that doesn't work, you can go to 1 milligram. You want to keep it under 2 because honestly, those are the doses that are still for over-the-counter medications for children 2 and under as well. And then if melatonin isn't working, then there are other things you can talk to your midwife about that may be helpful. Unisom is also very helpful. It's a category A medication in pregnancy as well. All right, so for those who are concerned about weight gain and saying, I can't figure it out, Dr. Adams, all I'm doing is having coffee in the morning, are you? Or are you having a salted caramel mocha monstrosity? Just one of my favorite drinks. Did you know that pregnancy only requires an additional 300 calories per day, which is not as much as you would think? I know all the aunties are saying, you're eating for 2, baby. Have 2 pieces of chicken. It only takes 10 calories to maintain 1 pound of body weight, and your goal weight gain is based on your starting body mass index. So let's say you start the pregnancy at 170. That takes a net caloric intake of 1,700 to maintain. If your goal is to gain 25 pounds, that's 250 extra calories you get for a total of 1,950. If we divide that by breakfast, lunch, and dinner, that's 650 calories per meal. That's food and drink. So you can't eat 650 calories and then wash it down with a 570 calorie mocha monstrosity. This busy slide here talks a little bit about where those calories should be coming from. Like the quick guide is 5% or less is low. Like that's not enough protein. It's not really even good enough for carbohydrates. 20% or more is kind of high. So dividing up your nutrients to make sure that you're getting enough things. And then the second part of this is just showing you how little changes can make a big difference, particularly for sodium. So in the third trimester, you're going to start retaining more water. That's normal. That's physiologic. Your body is supposed to do that. There's a reason behind that. But if you're eating traditional spaghetti sauce, you're going to be getting over 500 milligrams of sodium with each serving. Whereas if you substitute it with 20-minute herb infused marinara, you can cut out 500 milligrams of sodium. So you don't really need the extra sodium because your body physiologically is already retaining more water, and that's just going to add to it. And then you're going to be sending me messages about why your rings won't come off. So eat your fruits, eat your veggies, whole grain, cereal. You're not going to give your baby a nut or dairy allergy by eating those things during pregnancy, so enjoy. For my coffee drinkers, you can have caffeine. You just keep it to less than 200 milligrams per day, which is still a lot of caffeine. Please remember that caffeine is a diuretic. So as you are drinking your caffeinated beverage or eating your caffeinated foods, chocolate has caffeine, guys. Remember, you want to drink about 3 times as much water to be sure that you are still staying hydrated. Herbal teas are fine. Raspberry leaf, as I mentioned before, is one of our favorites. Ginger, lemon, and peppermint are helpful at different stages of pregnancy as well. For my vegetarians, pescatarians, vegans, you want to make sure you're taking in about 70 grams of protein daily. If I have bodybuilders who are used to taking in more protein than that, cut back, please. I know there are some pregnancy diets that are telling you to take in 120 grams of protein per day. Please don't do that. You will grow a 10 or 11-pound baby. And that makes things more difficult for both of us, really. 70 grams is plenty to support a healthy baby in pregnancy and mommy. Deli meat is a yes, as long as you microwave it for at least 30 seconds prior to eating it. Don't burn your mouth. You can let it cool down. Just make sure you get your 30 seconds to kill any harmful bacteria. If you're eating soft cheeses, be sure that they are made with pasteurized milk. If you can't verify, like at a restaurant, then don't eat the soft cheese for that evening. But if you're at Trader Joe's, just flip it over. If it says it's made with pasteurized milk, then you're good. Canned tuna, you can have 3 4-ounce cans per week. If you are a pescatarian and you need more fish than that, the FDA has a really nice document, even though that date says 21, that's the latest iteration of it. And this tells you about fish that you should eat in larger quantities because they're high in DHA, which is good for baby's brain development. Fish to eat in moderation because they're kind of neutral. And then fish to eat sparingly or avoid because of higher methylmercury content. You also want to avoid undercooked meats and fish. So if you are a foodie like me and your steak must be medium, sorry, you have to ruin your steak for the next 6 months or so and have it well done. That yummy ahi tuna as well is not for you. You can have your fried sushi and all the things that are cooked all the way through. Kombucha eaters, kombucha drinkers, and kimchi eaters, sauerkraut, all the things are kind of fermented. You want to limit those. They're not an absolute no, but you want to limit them because sometimes the way things are prepared, the fermentation process, your body can treat and give the same effects as alcohol. In that same vein, you want to avoid alcohol because we really do not know how much alcohol is safe during pregnancy. And just remember, alcohol-free wine still has alcohol in it. I don't know why they call it alcohol-free. Maybe they don't charge you extra for it and it's free, but don't drink it. And then you want to keep your sodium in total under 1,500 milligrams per day. So remember that herb-infused marinara, starting to look a lot smarter now. Any questions about food before we move on to exercise? All right, cool. Exercise in pregnancy. It is fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. You just won't feel like it in your first trimester. Don't be angry at yourself. In your second trimester, you're going to increase your blood volume, which increases your oxygen tension and saturations, and that'll make you feel more like doing that aerobic activity again. Your body will accommodate more of the activity because of these physiologic changes. So just listen to your body. Like it's going to tell you when it's okay to go back to being the Olympian that you were before. If you weren't doing anything before, no judgment. but it's time to start a new regimen because sedentary lifestyles lead to malpositioned babies. And what did I say before about C-sections and malpositioned babies? So if we're sitting down with hunched over our phone all the time or in weird chair positions, if you work remotely, all of these things can lead to babies that are sunny side up. If baby's spine is by your spine, that is a sunny side up baby. And for a first time mom, you then have a 5% chance of vaginal delivery. Our goal is to rotate baby during pregnancy, toward the end of pregnancy, so that baby's back is toward your belly. Resting heart rates, those of you who have these cute little Fitbit watches that give you a new reason to be anxious because your heart rate is changing, your resting heart rate is going to go up by 10 to 20 beats per minute. That is normal. That's physiologic. If it's not making you dizzy or lightheaded, don't sweat it. All right. If you're walking for exercise, be sure that your walking gets that heart rate, though, into the aerobic zone, which is 70% of your maximum heart rate. And we calculate your max heart rate by your age. So if you're 30 years old, you should not be exercising with your heart rate above 190 for prolonged periods of time. 70% of that, though, is where your aerobic zone begins. So if you're walking for exercise, your heart rate needs to be between 133 and 190 for 30 minutes, 3 times a week. That's your target, and that is your goal, to be able to say that your walking is exercise. If you're walking and your heart rate is still between 80 and 100, where it always is, then your walking is transportation, which is important, but it's not exercise. So what is safe for exercise in pregnancy? You can do cardio. You can get on the treadmill, the elliptical, running. I love swimming. It's cold right now. My babies swim competitively now, and they're still doing swim meets at 43-degree weather, and it just feels wrong. But heated pools, if you can find one, it makes your belly weightless and makes your joints move so much better. Indoor biking, if you're a Peloton or whatever person, go for it. That is safe in pregnancy. Weightlifters, you can lift up to whatever you were lifting pre-pregnancy, but you don't need to increase your resistance during pregnancy because your baby and your body are going to be doing that for you. Squats are amazing for baby positioning. So you want to build up to at least 50 squats per day. If you're an experienced squatter and you're already doing it, go for it. If you've never been squatting before, at 20 weeks, you start by giving me 5 a day. 21 weeks, you give me 10 a day. 22 weeks, you give me 15 a day. Y'all get really excited about having prenatal visits with me until you find out that there's a quiz. At the end of pregnancy, I start doing squats with you during your prenatal visits, and then you all try to avoid me. But squats are very important to getting these babies into the right position and getting that pelvis open and long and lean. In the same vein, Pilates and yoga are two of my favorite pregnancy exercises, and any experienced instructor will be able to tell you what the pregnancy modifications are. The things you want to avoid are the high intensity interval exercises after your first trimester. So it's not the interval, it's the intensity. You can do the low impact versions of these after first trimester. You want to avoid things that have you lying flat on your back for extended periods of time, like ab work. You can do side lying abs, you can do standing abs, but you just don't want to be on your back exerting yourself. Hot yoga, unless you're a hot yoga instructor and are fully acclimated to that climate, you will get dizzy and we don't want you to fall on your belly. Scuba, obviously avoiding because of decreased oxygen, because of the barometric pressure. Same thing with high altitude hiking. You can exercise, I mean, you can visit. You have family in Colorado that's 8 to 10,000, feet above sea level. That's fine, but you just don't want to go hiking with them. Contact sports, this is not the time to pick up kickboxing. Also, I've had questions about volleyball and pickleball, and just any ball flying at you just really concerns me during pregnancy. So if there's something else that you could do, that would be awesome. Outdoor biking after 16 weeks is not a no, it's just a be careful, because at 16 weeks is when your center of gravity changes. And as you start trying to turn corners on the bicycle, you may find yourself a little heavier on one side than you thought, and you end up falling. So that is that's exercise. So I have a poll question. Now that we have talked about diet and exercise, can you prevent gestational diabetes with just diet and exercise? I told you I was going to talk about gestational diabetes. All right, and the polls are closing in 5, 4, 3, 2, 1, done. All right, so my veteran mamas know me very well that the key here is prevent. You can manage gestational diabetes with diet and exercise, but you cannot prevent it. So the answer is no. Good job, mamas. Why? Because you know how we blame our hormones for like everything outside of pregnancy? Well, hormones are at work during pregnancy too, and insulin is a hormone. And the job of insulin is to clear your bloodstream of excess glucose. And when insulin is not doing its job, you have excess glucose, blood sugar circulating, which is diabetes. Your placenta gives off hormones that tell your insulin not to do its job. So, this is not a judgment on how you eat, on your family history, on your weight, on anything except for the fact that your placenta is giving evil messages to your insulin, telling it not to go to work today. And when your insulin calls out sick, you have extra glucose. So, if you do not have a placenta, then I do not need to screen you for gestational diabetes. But if you have a placenta, guess what? You're at risk. So, for my moms who say, but I never eat anything that has sugar, you eat good carbs, like you eat your fruits, you eat your whole grains. Don't avoid those prior to the test because you'll end up giving yourself a false positive on this test. If it is the contents of the drink that give you trouble, we have options. We have options. Remember that thing that I clicked on? It has patient-driven options on the website. So there's the fresh test. There are glucorganics. There are glucose tabs. We have for sale here in the office the Simply Pure drink, which is soy-free, it's dye-free, it's gluten-free, it's BVO-free, it's kosher, it's vegan. It's just glucose. It's offensive to almost no one. So please feel free to use some of these other options if you have a placenta, because we will need to test you by your 32nd week to continue care. Preparing for birth. Yay. Some of you are looking to do unmedicated births. Some of you are looking to just delay the epidural, so that it doesn't slow the process of your early labor. The things that are listed on here, one, for informational purposes, but two, they represent different methods like hypnobirthing, hypnobabies. I think actually, oh yeah, but Birth Your Way, there's Bradley method and Lamaze. We had lots of patients over the years who use these methods and do an amazing job with birth there. So please feel free to look into any of these things. We highly recommend them. First time mamas, VBAC mamas. Go for it. Breastfeeding classes, La Leche League has them. There is also Sonia at HCA is our lactation consultant, and she's fantastic. She runs a breastfeeding class as well. You don't want to wait till the last minute for these because sometimes they are several weeks in a series. So you want to get these out of the way in your early third trimester. Every new parent should know CPR. So even if you know adult CPR, you need to know infant CPR. Here's a link to the Red Cross. Take a class. Chiropractic care. If you're already seeing a chiropractor, fantastic. Please be sure that he, she, or that group is Webster certified, which is a specific certification for pregnancy, which takes into account the different ways that your body changes during pregnancy so that the adjustments are not dangerous for you or baby or for baby's position. How many of you are planning to work with a doula? I think I talked to some of you who already knew who your doula was going to be. Polls are closing in 5, 4, 3, 2, 1, and done. All right. I think this may be the first time I've ever had anyone to not say no. They're like either yes or I'm not sure. All right, so what are doulas? People say, well, I have a midwife, I have a doctor, I'm going to have nurses. How many people do I need for this? This is like going to the Oscars, girl. You need a whole team working on you. So doulas are there to provide your emotional and physical support before, during, and after pregnancy. So they're not just for people who want unmedicated deliveries. They could be for people who just maybe never done this before. Hey, first time mom, I'm talking to you. Maybe even VBAC moms. If this is your first time trying to have a vaginal delivery, you don't know what to expect. This is a safari. Don't you want to go on safari with a guide? Your midwife may have 3 patients in labor at the same time. Your doula is dedicated just to being in the room with you during labor, to do your breathing techniques, help you change positions, help you with relaxation strategies. They are not giving you medical advice. They're helping you process your feelings about the medical advice. They are helping you find your voice to help us. Like we're there. Like you typically don't have to fight with us in terms of advocacy, but just kind of reminding you how you wanted to do things and that sort of thing. So they're not actually providing the medical care or prescribing medicines or delivering the baby, but they are kind of the liaison when you lose your voice because you're having discomforts related to labor. If you are considering working with a doula, I recommend interviewing people and getting their personality. Last thing you want between contractions is somebody whose voice is super annoying to you, or someone who's not going to show up or really be there to support you. So ask the midwives who they have worked with before and who we have had support our moms in ways that were very beneficial to the mothers. Pregnancy acupuncture, pregnancy massage, also recommended. When you come out of the bathrooms in the front, you'll see a bunch of business cards for different businesses that we know work with pregnancy. And the question here is, how do you find a doula? Again, those business cards are when you come right outside of the bathroom. There are some doula cards out there too. And I mean, honestly, if you Google, doula Jacksonville, so many people will come up. So get their names, come in and talk to the midwives, and they will be there to tell you, oh yeah, we work with her. She's awesome. Breast pumps. Many of your insurances will cover breast pumps. Best time to try to start to get one is around 20-ish weeks or so. We have QR codes that make it very, very easy. Please use the company that's on our QR codes. We get no financial kickbacks from it, except for the fact that they save time. And time is money. So when you all go and find your own companies and try to do it on your own, one, the insurance companies give you a lot of runaround, and then they ask us a bunch of questions that really don't have anything to do with whether or not you need a breast pump. This company gets your insurance information. They send you an email saying what pumps you can get with your insurance, and then you pick it. They write the script, send it to us. All we have to do is sign it and send it back. It's very easy. You get your breast pump back in about 2 weeks. With these other companies, we're going on for 3 months, and you're sending us messages. Did you get the prescription So just please scan the QR code at 20 weeks. For those who are going to be using the Family Medical Leave Act to be out, we are contracted through a third-party vendor, Leave Guru. Most of those forms, if you've ever had these filled out before, sometimes it's like 5-10 business days to get them done. This company completes them in less than 24 hours, some even in 10 minutes. It's very easy. Kylie or Sierra will be the ones to help you coordinate that. So just contact us when you're ready to get those filled out. Postpartum care, because at some point the pregnancy does end. For those of you who have issues with blood pressure during pregnancy, first-time moms, listen up. 1 in 8 to 1 in 12 of you will have some issue with blood pressure where you've never ever had an issue with blood pressure before. And you're going to say things like, but I've never had an elevated blood pressure before. You've also never been 37, 38, 39, 40 weeks pregnant before. And again, this is your placenta, the villain, giving off hormones that tell your blood vessels time to constrict and get rid of me, the placenta. And so when the placenta does that and the blood vessels constrict, your blood pressure starts to go up, and it is time to deliver you to keep you and baby safe. If you have any of those blood pressure issues during pregnancy, we will see you back earlier after pregnancy, because postpartum preeclampsia, postpartum gestational hypertension is actually a thing. One of your most dangerous times for it is in the first 14 days after you deliver. If you have a belly birth, we'll be seeing you back at the 2-week mark for an incision check and then routine mental health screening. Again, baby blues occur in about 80% of women, not a huge deal. If they persist beyond 2 weeks, we start to worry, are we sliding into postpartum anxiety, depression, or rage? And so we screen again routinely postpartum. for mental health. Postpartum doulas are a thing. Remember, they're for emotional and physical support. Hey, when do you need that more than when you first bring home a baby? There are amazing women in this city who, for a fee, will come to your house and let you sleep while they do baby feedings and changings and all that stuff overnight. So look into postpartum doulas as well. We know who they are too, and their cards are out there as well. The Motherhood Space is an amazing resource here in Jacksonville. We're one of 5 grant cities in the country has access to this. They have light therapy, yoga therapy, individual and group counseling for moms who've been identified as having postpartum anxiety, depression, or rage, all covered by insurance or the grant. And they have on-site childcare at YMCA, the Winston Y downtown for 6 weeks to 12 years of age. So they remove many excuses that moms have. I can't get away because I need someone to take care of my kids. Bring them with you, girl. And these sessions are all covered. And then pelvic floor therapy is a routine referral in-house. We have a nurse who comes in on Tuesdays, Wednesdays, and Thursdays. And so when you are 8 weeks postpartum, routinely we bring you in for pelvic floor therapy because even if you don't push a baby out, carrying a baby on your pelvic floor increases your urinary incontinence, discomfort with intercourse. If you have a vaginal tear, pain with intercourse, and pelvic floor therapy helps to put all of that back together. Random frequently asked questions. We're almost at the end, guys, I promise. You can sleep on your left side, your right side, and your back. If sleeping on your back makes you dizzy, though, get one of those wedge pillows from Amazon, stick it under your hip, and you will feel much better. You can help with painting the nursery. Just be sure you're in a well-ventilated space or wearing a mask. You can take probiotics, prebiotics, postbiotics, all the biotics that they have come up with now. You can dye your hair, including your eyebrows. You can do gel nails if you're in a salon with a lot of fumes. Maybe you want to wear a mask so it doesn't get overwhelming. You can travel in the car up to 37 weeks, only because 37 weeks is full term. And again, your baby who doesn't have a calendar doesn't know that they're not supposed to tell you it's time to go into labor if you're not in Jacksonville. So if you're traveling past 37 weeks and you go into labor, you might deliver with someplace that's not full circle. And like, who wants to do that? If you're traveling long distances, though, please be sure you're getting out and stretching every 2 hours, which you will need to do if you're drinking the right amount of water because your bladder betrays you. Skincare, you can use your salicylic acid, your benzoyl peroxide, anything topical unless it contains retinol. There is a retinol substitute called bakuchiol, Bakuchiol, which has all the good properties of vitamin A without the things that are harmful to baby. The question I have out here now is, what about stomach sleeping? You can do that until your baby says no. There will come a point, like it's not dangerous at any point. Like your uterus is the safest place for your baby to be while you're sleeping. But there will be a point when you roll onto your stomach and your baby's like boom, 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 boom. Don't want to do that. And it becomes uncomfortable. That's when you should stop. You can fly in an airplane up to 32 weeks if you have twins, up to 36 weeks if you have a singleton, obviously if you don't have any other pregnancy complications. Just be sure you are wearing your medium compression hose, drinking lots of water so that you're getting up and going to the bathroom a lot, and doing your toe raises in the seats to keep your blood circulating when you fly. No roller coasters, no water slides. That is it for the frequently asked things. And then lastly, your upper respiratory infection update. Again, we are in the middle of crud season, so please pay attention. Vaccinations for flu, RSV, and COVID, ACOG strongly recommends them based on multiple studies. You can read the New England Journal one on 35,000 women with regard to COVID specifically. Moderna and Pfizer vaccines are okay for that, but just not Johnson & Johnson. If you plan to get your booster again, early 3rd trimester is the best time, so you'll have the antibodies to pass to baby and protect them after breastfeeding. Mixing and matching, so if you had Johnson & Johnson before, you can get a Moderna or Pfizer during pregnancy, and that's fine. And you don't have to time them against the other types of vaccines because they don't interact. They're all different. If you get COVID or any of the other cruds, there's no recommendation for ivermectin, azithromycin, or Plaquenil, so we don't prescribe those. What we do recommend is that you don't come here. Please don't come here. Please don't bring that here. We are a well office with lots of immunocompromised pregnant people. So if you come, it spreads to our staff, which then spreads it to everybody else. I'm down a front desk person. Last week I was down one ultrasound person. So please, we are a well office. Stay home and take your vitamin D, your zinc, and your vitamin C. If it's COVID specifically, you want to start a low dose aspirin until 36 weeks. If you get COVID after 36 weeks, then please don't start that because you'll increase your bleeding risk at delivery. Because we've seen a correlation between COVID and pregnancy and gestational hypertension. If you do contract it during pregnancy, then we'll be looking at serial growth ultrasounds to be sure that we're not developing growth restriction due to impending hypertension. You don't have to go to the hospital if you get any of these things unless you're not able to breathe or you're having a fever that you can't bring down with normal amounts of Tylenol. For those of you who had your last baby during the height of COVID, we are back to 4 visitors in the room. So yay, it's over. We're back to normal. So 4 visitors, your doula does not count as a visitor, like your DONA certified doula, like not my cousin's a doula, so she makes 5. But your actual real doula. We're not masking routinely in the room or in the hospital at all, or in labor unless you are actively like COVID, RSV positive, flu positive during labor. And even if you are, we don't separate you from your baby. You're given an isolate and an N95 mask to protect your baby from the respiratory droplets. All right, last poll question I have. What things can you find on the website? Can you find on our Full Circle Jacks website birth plans, safe medications, what to expect at each visit? Or are you a stellar test taker and you know that this is the right answer? Everything. Awesome. Polls over. Good job. All right, you guys are amazing. The next question I have here is, do the dads count as visitors? Yes, they do. No one's ever asked that, but yes, dads are like anyone who's not in your body, like your baby doesn't count as a visitor, although technically they are another person. But yes, dads do count as one of your support people. Yes, absolutely. Any other questions before we end? Because we are social, so please follow us on all the things. We are probably going to post more things soon. I promise this every week, and then I'm still old all week long, so we don't get someone to run my social media one day. I'm sorry you answered this, but you said we can eat and drink during labor. Yes, it is not evidence-based to starve people during labor. Next question is, when is it safe to use an at-home Doppler? By the time it's always safe, but by the time it's not nerve-wracking, you'll probably be okay to just follow baby's heart, or baby's wellness with fetal kit counts. It's just kind of hard to find the heartbeat, and when you don't find it, it freaks you out a little bit more. But technically, you can use a Doppler from 12 weeks on. It's just a little difficult to find the heartbeat there, but safe is at any time. And then the next one, can we give birth in the tub? Our tubs are for labor; they're not for birth, and so we typically do not have people pushing in the tub or delivering in the tub. Next question, is it bad to not do NIPT at age 40? So NIPT, for those who don't know, is the blood test that looks at chromosome counting. And I always tell people it's just how much information you want and what you'll do with the information. For us, it does not make any difference in your care. The things we need to know are things we'll see on ultrasound. Is there a heart defect? Is there, something that requires you to be someplace where there's a neonatal surgeon immediately available? If you are someone who needs to know whether your baby is going to have some chromosomal abnormality because you want to prepare yourself by finding what specialists, or learn more about the condition itself, that's a good constructive use of that information. If it's just going to make you more anxious and not bond with the pregnancy, then it's not a good test to do because you're not it doesn't change anything. But this is just for people who want more information. So no, there isn't a positive or it's not a good or a bad thing. It's your choice. You decide, we deliver. All right. Any other questions out there? Okay. You guys have been awesome. Thank you so much for your time, rocking with me a little extra today. So happy that you all chose Full Circle. We are happy to be taking care of you. If you have any problem, concern, or whatever, don't go to Google. come to me. You have access to me. You have a portal that you can send me messages directly. I will work to resolve them personally. And so going to Google really does not solve your problem. So please bring any issues to me and we will get it fixed, because we know that you can choose lots of OBGYNs, but you decided to come and hang out with us. And so we want to make it a pleasant experience for you. Thank y'all for your time, and we'll look forward to seeing you in the office really soon. Stay warm, y'all. Bye.